Okay, so I am here in Mr. Ivan Emoto's room. I had just finished a head-to-toe assessment and I'm getting ready to call the doctor. So ring ring. Hi, my name is Sarah. I'm the nurse taking care of Mr. Ivan Emoto here in room 148. He came in with chronic heart failure exacerbations, experiencing some shortness of breath. He was first diagnosed with chronic heart failure at the age of 60. He doesn't have any significant other history that is important right now. No past medical history or surgical history. He did have a right inguinal hernia repair at the age of 52. But going over my assessment, I did notice that he had some crackles in the lower lobes of his lungs. His respiratory rate was pretty high. I did raise the head of the bed and titrate oxygen to get his O2 sats up to 92%. He was having trouble breathing, experiencing some shortness of breath. His respirations were deep and labored. Going forward, I did notice that he did have some crackles in the lower lobes of his lungs, and he has been experiencing a productive cough as well. Going further into my assessment, he did have some pitting edema in the lower extremities of his legs, which is probably due to the chronic heart failure. His hemoglobin, hematocrit, and his CBCs were a little low. It could just be from anemia or dehydration. His BUN was a little low too, which could be from dehydration, or it could be some potential renal issues that's going on due to the chronic heart failure. I am most concerned about his ABGs. It is showing that he is in respiratory alkalosis. So I would recommend maybe getting a respiratory therapist consult for Mr. Ivan Emoto, and then maybe increasing his furosemide to 40 milligrams, just because there is an extensive amount of edema and it seems that the fluid is not coming off of his tissues. So just increasing the furosemide to 40 milligrams might help out a little bit. So I'm going to repeat the orders back to you. We have a stat consult for a respiratory therapist, and also we are going to increase the furosemide from 20 milligrams to 40 milligrams for the next dose. Okay, thank you.